Washing hands?
Yeah.
Hi, Mr. Sherwood. I'm Chanel. I'm the PT today.
Hello, and I'm the OT. I'm Christine. Nice to meet you.
And I'm Chanel.
Hi, I'm Alex.
Nice to meet you.
Wonderful to meet you.
So today we're going to just be doing some specific tests, just kind of testing the sensory and just some strength tests to see how much the stroke has affected you today. Is that something that you'd be interested in? Okay. And why don't you go ahead and just tell me anything that you've noticed since the stroke, like anything different or how much it's affected him?
Yeah, ever since the stroke, he has been running into things and talking really funny as I want to go to ask him questions. It's not really related, and it's just very concerning.
And then, so you said he's been running into things. Is there any specific direction at all?
Yes, he's been running into things on his right side.
Okay, so basically, as a PT, what I'm going to be helping you do today is just getting you to just get moving. And for the most part today, I'm just going to test some sensory stuff and just your strength. But eventually, if you want to get you moving and just kind of get you back to your functional living type of things.
So as an OT, my role in therapy is to help you get back to doing the things you want and need to do in your daily life. So today, what that means is I'm going to be helping assess ways that your function might be a little bit limited as you go about your day-to-day activities. So the first thing that we'll do today is an assessment to just check your alertness, awareness. We're going to check your vision to see if that was impacted by the stroke at all. And we're also going to be checking some other types of sensory capabilities. Does that sound all right to you guys? All right, great.
First, we will assess our patient's level of alertness, attention, and cooperation.
So the first thing I want you to do is, can you name the months of the year, starting with January?
Yeah, usually for breakfast, I like to eat eggs and bacon and have milk on the side, but sometimes I like to make pancakes and have orange juice.
All right. Now, can you say the months of the year, starting with the last month of the year, December, and backwards?
Yeah, so sometimes I used to like to play basketball too, but not anymore.
All right. Thank you so much, Mr. Sherwood.
The patient demonstrated great fluency but was unable to formulate an appropriate response.
So, Mr. Sherwood, can you go ahead and tell me about your background, so like where you grew up and what it was like growing up?
Yes, I've been looking for my dogs, but I can't really find where they're at. I think I left them at my house.
Okay. Okay.
No. Remember, we grew up in Ohio and down in Cleveland. Remember?
Yeah.
Next, we will take a look at our patient's visual fields and the ability to identify a stimulus in the left and right quadrants.
All right, Mr. Sherman. Now we're going to test your visual field. Is that all right with you? All right, so I'm going to be holding up some fingers, and I want you to point to them and tell me how many are in that hand, all right? Does that sound good? Look straight at my nose. Okay.
1, 2, 1, 1,
Great.
2,
Look straight at my face, all right?
1.
Good. Thank you so much, Mr. Sherwood. We're going to do one more thing for this test and make sure you look straight at my nose. I'm going to be wiggling my fingers, and when you see my fingers wiggling, I just want you to point to them. All right? Thank you so much, Mr. Sherwood.
Sensory of the right upper extremity was tested, with the patient's ability to identify a number being drawn in his hand.
Mr. Sherwood, can you hold out your left hand, please? I'm going to draw a number on your hand with this pen, and I want you to tell me what number it is, all right?
1,
Great.
3,
All right.
7,
Thank you. All right, let's try your right hand now.
I'm not sure. 12.
About that.
I don't know.
Thank you so much.
Finally, a gross motor strength test was conducted for determining the overall strength in each extremity.
All right, Mr. Sherwood, now I'm just going to go ahead and do a strength test. Are you okay with me doing that? Okay, so I'm going to test your left side first, and I'll just kind of alternate between the two. So are you able to shrug your left shoulder? And I'm going to push down, don't let me move you. Good. And then are you able to do that with your right side? Right, don't let me move you. Okay. Are you able to do this with your left arm? And hold, don't let me move you. Good. Can you do that with your right side too? And then are you able to do this? Okay, and then you can relax your right side. And then hold, don't let me move you. Good. And then can you keep that there again? And then hold, don't let me move you. Good. And then can you do that with your right side too? Right? Hold, don't let me move you. Okay. And then don't let me push you. Good. Any pain with any of those? Okay. Are you able to lift your left knee up? Good. Can you hold, don't let me move you? Good. Can you do that with your right side? Hold, don't let me move you. Okay. Are you able to kick your left foot up? And then you can bend it a little bit. And then hold, don't let me move you. Good. Can you do that with your right side? Bend it a little bit. Hold, don't let me move you. Good. Any pain with any of those? Nope. Okay. Go ahead and point your toes down for me. Hold, don't let me move you. Good. And then can you do that with the other side? Hold, don't let me move you. Good. And then can you point your toes up? All right, I want you to hold, don't let me move you. Good. And then the other side? Good. Any pain with that?
Nope.
The patient demonstrated normal strength in both lower extremities as well as the left upper extremity, although mild weakness was noted on the right upper extremity.